Welcome to Discovering 615, the podcast celebrating the people, places, and stories that make Middle Tennessee amazing. From local business owners and entrepreneurs to musicians, creators, and community leaders across the Nashville and Middle Tennessee area, we're shining a light on the heartbeat of our community. And now here's your host, Rob Thacker. Thack Attack 615.
Hey everyone, and welcome to another episode of Discovering 615. I'm your host, Rob Thacker, and I am joined today by Cari Lambrecht, who is Director of Marketing and Communications at Highpoint Health. Cari, thanks for coming on the podcast.
Of course, I'm glad I could finally get here.
We've been doing this for a couple months now, right? Playing tag, email tag, or phone tag, or text tag, something.
Always something.
It's all good. So tell us, give the folks some background. How did you end up in Nashville? Are you a native Nashvilleian, or is it somewhere else? Or how did you get here? And
part of the problem, I came here from Texas.
Hey, there's that relationship between Texas and Tennessee. I mean, remember the Alamo, for crying out loud. You know?
Exactly. And both share the shades of orange.
That's
so
right.
Came from the other UT. Don't hold that against me. But yeah, I got here in 2019 from Texas, moved to Tennessee. You know, it was a lure. It was a change of pace for my family and I. My husband was on the job market. A job brought us here. I already worked in healthcare. Didn't know Nashville was the healthcare city, and it has been great for me here in the Nashville metro area. Just kind of growing my own career in the healthcare industry, and I joined Highpoint in February of 2022 after being at Vanderbilt for about 3 years. And like I said, I've been in healthcare for roughly, 15 years in communications. Prior to that, I was with county government, so I was doing some public health and like infrastructure. I worked for a county, the 7th largest county in the state of Texas, I was a public information officer there, and prior to that I was a journalist. So I've always had storytelling in my blood. I love to tell people stories, just communicate really complex topics. That's what I enjoy.
And you focus, like you said, you got intrigued. You've been in healthcare for 15 years. Mm-hmm. What was it about the healthcare industry that kind of drew you into that? I mean, in terms of the storytelling, you said you were a journalist, but the storytelling, because that's fascinating.
Yeah, I think it was my time at the county when I worked for Hidalgo County. We had a lot of public health crises at the time, from flooding and subsequent mosquitoes to H1N1, which swine flu, if you remember that.
Oh yes, I remember that. Yeah.
Lots of hurricanes, and I was like in emergency management, public information, and so really public health. And I think keeping people healthy and just really seeing some of the health challenges, disparities, low health literacy, that's what pulled me into healthcare. And I think whether you're public sector, private sector, nonprofit, for-profit, there's just huge impacts you can make in communications and marketing, and the field has changed immensely. More from like an order taker, like make me a flyer, to really a strategic partner. Mm-hmm. And so that's how I see myself, working on special projects and advising leadership on, maybe what message lands. Internal communication is so important. So workforce development and making sure we're being transparent with staff. I kind of do it all. And that's why I really like the small feel of Highpoint. It's a community-based hospital, so we've got a lot of resources and backing because we're part of a larger organization, but we're still, serving the people of Sumner County, and there's not a lot of like barriers to get to us.
Right. Well, and you talk about that too, because like I know we had chatted earlier a while back, Sumner County, because like I work in the real estate industry, people want to know, you don't just buy a house, you come into a community. Talk a little bit about how Highpoint has really developed in terms of the healthcare industry in Sumner County. Because again, Hendersonville was voted, I think Newsweek, I think last year, a couple months ago, had Hendersonville is the #1 city to move to in Tennessee. I mean, that's hard to believe for 2025, 2026. And so people want to, hey, the city by the lake, you know. But it's not just about your house, it's also about how you live, your life, healthcare is part of that. Talk a little bit about the healthcare in Sumner County. I mean, because there's some amazing things here.
Yeah, I mean, I know for our organization, there's quite a long history there. So the hospital I work in, which is Highpoint Health Sumner with Ascension St. Thomas, was Sumner Regional Medical Center, and several other names. I'm probably not the best one to give a full history, but it's 65 years old. I mean, that was the county hospital. So it has decades long history in the community. And then, of course, we have our other community hospitals in the 1950s. The Trousdale County Hospital was born from, you know, the vision of a surgeon in that area and a family. Our hospital in Riverview, there were 2 hospitals in that community at that time. You know, those have gone through a lot of changes, but they remain rooted with some like core like just family values and people who've like grown up there for a long time. So we have some long-term employees, people who've been with us for 50 plus years. And I think our hospitals are made up of people who've grown up here and lived here, and plus people like me who've moved here, adopted. Right. You know, this is our own. It's, you know, it's changed, but its core is still like really, you know, giving back to the community. And you're right, like people do move here, I think, for that sense of like, we're not Nashville, like we want to be close to Nashville, you know, because obviously there's a lot of cool things to do there. And, you know, specialty care and connected care. So I think where we've evolved is, you know, we have a big history of healthcare. We're 65 years old, you know, we've delivered generations of babies. But we also now, with our partnership with Ascension St. Thomas, we have connected care with a much larger entity. So like those same specialists that are seeing you downtown are the same people who are coming to Sumner County for your cardiac care, teleneurology for stroke care. So that's available here in our city. So we don't have to go downtown now. And that's amazing. And I think that's what continues to draw people out to Sumner County. Like, is just, we kind of have the best of both worlds. Like that smallish town feel, if we can get the traffic a little better.
I think it's getting better. Of course, now Highway 65 is a nightmare to drive if you can avoid that after
smallish town feel. And, you know, but good quality healthcare and schools. I mean, schools is what, and education. And that's what brought us out here. I mean, coming from Texas, we looked all over the place. It was like Nashville, man, it's not too much for me. You know, Mount Juliet, we went to Wilson County, and I know when we bought here in Hendersonville, it was really the schools, I think, that did it for me.
I know that was the case for us when Elizabeth and I moved here in 2011. Just looking at the schools, and we looked at Sumner County, and we were like, oh, Hendersonville, yes, okay. But to see Hendersonville grow, especially in the healthcare field, and again, for us, with my wife's breast cancer, she's at 10 years clear, but St. Thomas is where she did her surgeries. And we love St. Thomas. So St. Thomas has a special place in our hearts for that, you know. So what are some of the, so we talk about the great things going on in Sumner County, but what have been some of the challenges that we've seen? And what are some of the things that Highpoint has faced in terms of, especially since you're on the communication side of it, getting the brand out there, getting the communications clear out there? What are some of the challenges you're seeing in terms of getting things, messaging, I guess we could say?
I mean, like people, I think businesses always go through seasons too, right? So there's been challenges throughout the hospital's lifespan. You know, just with different leadership, with different times. I mean, I can speak more knowledgeable about last 4 years since that's
Right.
when I've been part of the organization, but I do know that the organization I walked into in 2022 is not the same organization it is today. I remember going and interviewing, and it was a very quiet hospital,
Mm-hmm.
and we had a little hesitation. You know, we had just gotten off the roughest part of the pandemic.
Oh yeah.
And so I think really we had to rebound from that, and it was a time of healing. Really, the hospital had to kind of say, I want to reinvent myself. You know, I've been an important, integral part of the community for so long. You know, we went through this really trying period where we kind of had to insulate ourselves.
Right.
Not be so much in the community. That's what I heard from a lot of our leaders was like, hey, the hospital kind of like shut itself down to take care of those most vulnerable. I mean, there was nothing wrong with that decision. It had to, but it had the reputation as the COVID hospital. And so it was like, how do we kind of reinvent ourselves from that? And it wasn't just through marketing. There was like operations and leadership and recruitment and investment and a whole slew of things that had to be done. But that's what I've really seen. I would say like 2022 was like healing, rebuilding.
Gotcha.
2023, I think there was a lot of movement behind the scenes getting this partnership in place. In December of 2023, we announced Highpoint, our parent company, and Ascension St. Thomas formed the joint venture that is Highpoint Health with Ascension St. Thomas. So since then, I mean, I feel like it's been a rocket ship. Like, you know, reputation, recruitment, it's easier. You know, we're just constantly bringing in more doctors. I think the vision is there. You know, we see the gaps. It's primary care. It's, you know, getting people access to care when they need it, where they need it, building more freestanding ERs, and then, you know, cancer care, cardiology. All of these have become areas of lots of investment and growth for us. And, you know, we're on the path to turn our Sumner Station facility into a hospital with inpatient beds and a pediatric unit, which would be the only one in Sumner County, believe it or not.
That's
how big this area is.
Yeah. I think that's the interesting thing, how big Sumner County is. People forget. I mean,
and then we don't have a pediatric unit here.
Yeah, that's interesting. That's great, but that's exciting to hear. So so what are you've started to touch on where the future of Highpoint's going and LifePoint's going with Ascension St. Thomas. So what are some other things you can tease the audience with?
Sure. Well, I guess just to elaborate a little bit more. So the Sumner Station project is, you know, where all of our heads are right now. We did try to get state approval for this last year around the same time. The state they came back to us and they said, you know, actually we want more than what you're proposing, just the inpatient beds. We think we need to have a cardiac cath lab there and an OR. And so listening to the needs of the community, the team went back and formulated an even better plan. So that's where we are right now. So Tennessee is a certificate of need state. Believes that, you know, it wants to have, you know, a little more regulation of where health facilities go to make sure they're maintained well, staffed well, there's not duplication, there's actual need. And that's fine if that law is changing in the future, but for now, that's what it is. So we're seeking state approval, I should say, next month to turn Sumner Station into a full-fledged hospital. The existing services there, which has our cancer center, our ER, our therapy, and imaging, that will remain. So that's a big project. Other cool things coming down the pike for people who live in Sumner County is more cardiac care. So we're bringing in 3 new interventional cardiologists this summer.
Wow, that's great.
Yes.
That's exciting.
2 of them are female, so I think for women's heart care. I mean, you can go to any gendered individual that you'd like, but I know like going to a woman, for my own heart care would be,
Sure,
I
absolutely.
think just next level.
Absolutely.
So I'm excited about that. We'll be able to do electrophysiology. Our cath lab is undergoing renovations, so we'll have the most advanced, cath equipment, so we can go in and, we can't do like open heart surgery, but we can do the pacemakers and all that kind of stuff, and clear out your arteries and look inside your heart and see what needs to be done next. So we've got we've got 2 right now, and then one's going to undergo an upgrade here in the next month. Another awesome service line is women's health. We're adding midwifery services.
Oh, nice.
In like the next 2 weeks, really.
Oh.
We've never had that before. And so I think that's another thing that the younger generation especially is looking for.
That's interesting. That's interesting that the younger generation is looking into that more and more.
Mm-hmm. Yeah, just like more holistic, like whole person healthcare. It's not like I want to be attached to all of these, leads and forced to lay in bed. A midwife is there, so low risk birth. Our physicians can focus more on those who have higher healthcare needs, and our midwife can, medically manage those who are want to give birth in the least invasive way possible.
Right.
I mean, it's like you could do it at home, but you have the safety net of a healthcare facility should you need that.
Sure.
Yeah.
Absolutely.
So
That's amazing.
I think that's a huge patient satisfier right there. And then we're adding some new NPs to that clinic. So just overall expanding access for women's health. And then we have a navigational bronchoscopy device and expert. That's really the gist of that is you can detect and get rid of lung cancer a lot earlier.
Oh, wow.
Yeah.
That's amazing. That sounds really amazing. Well, it sounds like you guys have got a lot of, it sounds like compared to what you were saying when you came in and leadership, it sounds like leadership is a key going on here. Talk a little bit about where that is in terms of the leadership, what's going on with Highpoint in terms of the leadership, because it sounds like you're seeing a lot of solid leadership decisions being made that are for people.
Yeah, and I think that's always been the case. Like, we're here to help people breathe easier, to recover, rehabilitate with dignity, respect. That's why we exist. And like one of the things we always tell the staff is when you go in that room to take care of a patient, you act like they're the only ones. Like we kind of like leave everything else out the door, don't talk about the bad day you had with your coworker, or that you have all these other patients, or the stress because the patient wants to hear that they're the only one and you're solely focused on them. That's kind of what we preach, what we teach, what our motto is. It's patients first. They've always been first, and I think leadership has recognized that. There's been a lot more intentionality placed on like quality metrics and making sure that things are repeatable, and we have a culture of safety where staff can come, be part of after action reports where maybe something didn't go right, but we can all speak up and look at the root cause of the problem and build upon that. So I think that there's a lot of transparency and openness, I think, in the organization. Like we're doing town halls this week.
Oh, wow.
It's Nurses Week. Next week's Hospital Week.
Yeah.
So, we're bringing in our staff to tell them a lot of the stuff I'm sharing with you, so they also know, because from my perspective, the staff are the best marketers, and they need to know what's going on, and hopefully they can share a little bit of that with their family, their friends, their communities, their churches, maybe not as in-depth as like a
Right.
CEO would, or a word nerd like me. But I want them to be proud of where they work.
Sure.
So yeah, it's just instilling pride.
So you've covered a lot of topics. So what would you give in terms of, and you've talked about the patient care. Obviously, patients are clients. Your patients are important. We've discussed that. But what about someone who is looking to enter into the healthcare workforce? What would be some things where, like, for example, where's the starting point for them? If they're saying, hey, I'm graduating from high school or college, I want to get involved with Highpoint and get involved with the workforce that's in Sumner County or just in Middle Tennessee, where's the advice? What recommendations do you make for someone like that?
Yeah, we love hiring local talent, first of all. So, like, people don't need to leave this area to find great jobs. They're right here. You can get a lot of experience in our facilities. There are tons of programs. We work closely with a wide variety of schools of secondary education. So Vol State comes to mind. They're a great partner, their nursing program. We also help support programs at Welch College, Union University. So I did start as early as high school. Like, if you're interested in the healthcare industry, get involved with HOSA.
What's HOSA?
HOSA is like Health Occupation.
Okay.
It's a student association that a lot of the schools have. So you'll be able to learn about all the different healthcare occupations. We've got a really cool event that's going to be hosted at Highpoint Health Sumner in August that will bring in some of the HOSA students, and they'll be able to meet like real world and ask questions and see what they do, like day in the life of, with all the different healthcare professions. So like, what do you do as an OR tech? What do you do in radiology? What do you do in as a OB nurse or a trauma nurse? So they can ask questions, discover. We'll have some like breakout sessions, panels. We're in the midst of planning that right now. There's like a nursing camp coming up that Union University hosts. So like, we encourage students to just get involved in all of those different things. So Sumner County schools and your local colleges, they know that like this industry needs competent workers, and they're doing everything they can to get people excited. So we partner with them quite a bit. So and we're working. I know our director of education is working on some other stuff to allow more internships and shadowing opportunities. I don't have details on that yet, but we are continuously revamping those opportunities to get more students in the door. And then even if you're just older and changing careers too, the educational pathways, like to get into anything in healthcare, are 2 years. So and you can become a patient care tech with very little schooling.
Interesting. Fascinating. That's great. And it sounds like the community, from what you just described, is very involved, and Highpoint's very involved in the community. I mean, the connection with Union, everything which is great. I think that's awesome. So if people want to find out more information about Highpoint and about some of these things going on, where can they connect with you?
I like to think we do a pretty good job on social media. So we're trying to promote all these things that I talk about there. So we're on Facebook, we're on Instagram, and we're on LinkedIn. So your preferred social media choice. So connect with us, follow us. Our websites, we have a website for the hospital system, highpointhealthsystem.com. And then we also have one for our employed practices, which is highpointhealthpartners.com. So know that everybody should know that there's a lot of job opportunities there, and those are our clinics. Usually that's the first place you're gonna experience Highpoint is in those clinics, whether it's your family doctor or our orthopedic clinic, which just got a new location.
That's
But
awesome.
you know, go in there and just, the number one thing is have a doctor, and I think that's how you could, aside from social media,
Mhm.
like get yourself connected with a doctor you trust, whether it's your women's health doctor if you're female, and get those annual checkups, get your screenings, go to primary care,
Mhm.
to start building that relationship. Healthcare is so much better when you have someone to just talk to and
Right.
know your baseline, and then so if something changes, you know, you can take action on that.
Gotcha. And you mentioned social media. So is social media also Highpoint Healthcare? Is that the social media for the Instagram and Facebook, or is it something different?
On Instagram, it's highpoint_health.
Okay.
And then it's, my goodness, you're asking me a hard question. Our handles, I don't have those in front of me here.
That's okay, folks. You can search on Facebook, Instagram, which is what I do.
Just
We-
search.
Just search. You guys can Google it. You know what it is. People are tech savvy enough. So anyway. Well, Cari, thank you so much for coming on.
Thank you.
Enjoyed listening and excited to see what's going on in Sumner County, especially in the healthcare
Same.
industry.
Thanks for having me.
You're welcome. So, folks, share this episode with someone who needs to hear it, and don't forget to like, follow, or subscribe wherever you listen or watch. And as always, find your place, find your people, discovering 615.